This video demonstrates gastrocnemius recession surgery for a 2-year-old chronic non-healing trophic ulcer of left foot plantar aspect with a tight contracted gastrocnemius muscle. I am Dr. Premkumar, podiatrist. Skin incision has to be marked slightly away from the midline at the end of the gastrocnemius muscle, where it continues as a gastrocnemius tendon and joins the soleus muscle. Gastrocnemius tendon has to be identified and has to be cut and released horizontally, followed by soleus muscle fascia has to be cut horizontally, exposing the soleus muscle bulk. Once this is done, you can able to feel the ankle and foot, which easily moves dorsiflexion, which was earlier in equinus position because of the contracted gastrocnemius. The wound is then closed in layers and skin stapler has been applied. The third and fourth metatarsal head of the left foot has to be opened by a dorsal vertical incision, avoiding an injury to the extensor digitorum tendon. It has to be deepened up to the metatarsal head, and a floating osteotomy has been done so that the pressure on the metatarsal head is also simultaneously relieved. Once the gastrocnemius contracture has been released, the foot usually moves freely into dorsiflexion and the local pressure at the metatarsal head has been addressed by a floating osteotomy, which will decrease the pressure over the MTP joint of the third and fourth metatarsal, so that the healing of the trophic ulcer will occur very fast. Usually it takes 2 weeks to 3 weeks completely for the trophic ulcer to heal. A nylon posterior slab has been applied so that the released gastrocnemius tendon is put in that position. After 2 days, we will suggest the patient to do a dorsiflexion passively by a stretchable band, and the physiotherapy has to be started. The patient will be put in air walking boot after 1 week. Gradually after 3 weeks, the wound assessment has to be done and the staples and the suture will be removed, and patient has to be given a customized insoles which supports the arches of the foot. Thanks for watching.